It's very good, I think, that you started this off just before I came in here to have a conversation about politics. And I know this group has never shied away from having that discussion, and it's so important. Because depending on the affiliate that you originally come from, affiliates tend to approach this stuff in different measure, depending on what their constitution says. Us at the BC Federation of Labour, as Brother Cubey, one of our past presidents, knows so well, is not constrained by such restrictions. And so I'm quite happy to talk very openly about what I think we should be doing with your agreement to ensure that we turn this country around again. And we've got two very important elections coming up. The first one is this year, as Jenny just talked to you about at length. And the second one, of course, is in 2017, where we get another crack at turning this province around and hopefully repeating what they did so wonderfully and surprisingly in Alberta. And so we're quite excited to do that. I was just in Kamloops yesterday, actually, because the Interior Health Authority is considering following the example of the Lower Mainland Health Authority here, Vancouver Coastal Health, and I think possibly even Vancouver Island Health, and in privatizing laundry services. And this is just such a bad move. And so I landed in Kamloops yesterday, quite eager to see the progress of our Premier's jobs plan. Because I think Kamloops, in many respects, is ground zero for that jobs plan. They've got two high-profile cabinet ministers there, one for transportation, highways, infrastructure, and also the new health minister. A sister here from Vancouver Fairview, and any others that also live in this riding will recall that we worked very hard in 2013 to dislodge the previous health minister, who's still actually in the headlines today because of the very unfortunate health firings that took place, right? And the very unfortunate suicide as a result of the defamation of those employees, members of this union, the BCGU actually. And so we worked very hard to dislodge her. We were quite happy to do that, but of course we ended up with this Terry Lake, really no different. And so we went to his office yesterday to protest this. And so the Labour Council was there. There was good support from a number of different unions in the area. And it's just such a bad move. And we know why it's a bad move, because it hasn't worked in the Lower Mainland. So for example, as I was getting out to the airport, those of you may know Susan Orr. She's worked in our office at the BC Fed for many years, works very hard. It's just, she pulls me out of the fire on a daily basis, member of Code 378. Very proud to be so. She says, Aaron, before you go, I want you to tell a story about my mom when you get to Kamloops. And she talks quite often about her mom. She was a very strong woman. And she said, here's the story I want you to tell. Because when it got to the point where I had to put her into assisted living, she ended up going into a facility in the Fraser Valley that was administered by the Health Authority. And we had just, it was one of the first encounters I had with this privatization of laundry services. And this is what they told me when I first put my mom in there. They said two things to me. The first one was, it's a good idea for you to show up every day to make sure that your mom gets 3 squares. Because we just haven't got the staff to ensure that she'll get all that food. The second thing they said was, you'll also want to bring some sheets with you and make sure that you change the sheets, because we've only got a contract to be able to afford staff to change those sheets once a week. And we understand your mom's incontinent, and so if she has an accident at the beginning of the week, she's going to have to stay in those sheets for 7 weeks. And this stuff is incredulous in a country like ours, where the party that we support so strongly fought so hard for centralized, public, accessible, universal health care, and yet this kind of stuff is happening.